Hello, hi, namaste, Kem Cho. This is Daksh from MedicBird. We met again, and I hope your 2024 is going as good as I wished in the last podcast. So, today we are not going to talk about any other surgery, but we are going to talk about technology, जो मातृत्व का जन्म देती है. Isn't it beautiful? Yes, we are going to talk about IVF, in vitro fertilization. इस पॉडकास्ट में हम डॉक्टर नेहा गोयल जो आईवीएफ स्पेशलिस्ट है, जिनका नीव आईवीएफ सेंटर जो वीएस के एग्जैक्ट बगल में है, उनके साथ बात करेंगे. तो ये पॉडकास्ट मैं आपको अभी से बता दूं, जो लोग पिछले 1 साल से चाइल्ड प्लानिंग में स्ट्रगल कर रहे हैं, जिनको रिजल्ट मिलने में प्रॉब्लम हो रही है, आई मीन दे आर नॉट गेटिंग एनी रिजल्ट्स और काइंड ऑफ दैट, or people who are struggling with infertility, then this podcast is for you. So let's make an insightful conversation with Dr. Neha Goyal. A very warm welcome, ma'am.
Thank
you so much with us and making a beautiful conversation and fulfilling IVF section with MedicBird.
Yeah, thank you.
So it's been an honor. So let's make this conversation beautiful for the audience. So in this episode, we are going to talk about IVF basics, of course.
Yeah.
So, what is an IVF and who might need it?
See, IVF stands for In Vitro Fertilization. There are two terms if you have heard of, like in vivo and in vitro. What is in vivo? In vivo means anything inside happening inside a living thing, जैसे कि हमारी body में. And in vitro means anything in petri dish, anything in laboratory, anything in test tubes. So the basic process which gives rise to pregnancy, that is the fertilization of egg by a sperm, which is not happening in vivo inside the body of the patient. That's we are doing it in a laboratory, in a petri dish, and that's why we call it as in vitro fertilization.
Okay, that's beautiful. Okay, so now second question is that what happens during an IVF cycle?
So during the first consultation, when the couple walks in our clinic, so we review their case. The first step we do is the basic ultrasound of the female partner, semen analysis of the husband, and other medical records of the patient. First, we try to find out what could be the major reason that they are not ending up in pregnancy. So after those medical tests, and if the couple is have undergone already other treatments like IUI, they have already done multiple ovulation induction cycles, they have done. So we try to counsel them for IVF, and if they are ready for IVF, then we start the treatment of IVF from day 2 of her menses. So from day 2 and day 3 we start the injections. करीब 10 से 12 दिन लगते हैं पेशेंट को, and after that, after 34 hours of last injection, we take the patient for oocyte retrieval, that is egg retrieval procedure under anesthesia. And in that procedure, it's a basic day care procedure, absolutely safe, done under anesthesia without any pain. So after that, we fertilize the eggs by the sperm by a specialized procedure known as ICSI, that is the intracytoplasmic sperm insemination, which is done by a specialized person known as embryologist. Okay. And then we culture those fertilized eggs in laboratory till day 5. And when those embryos are formed, we generally freeze them to have a safe cycle. Safe cycle means safe treatment. Patient should not end up in OHS. That is one of the complication of IVF
what
treatment.
What is OHS?
Ovarian hyperstimulation syndrome. To prevent that patient from going into OHS, generally we don't transfer the embryos in the same month. We freeze the embryos, let one menses come, and in the next menstrual cycle we transfer the embryos after preparing her uterus with hormonal medicines.
Oh my god, it's a huge cycle.
It's actually a huge process.
I was expecting very small cycle, but
no. It is a small, but in listening I think you are feeling it's huge.
Oh, actually. So is IVF the only option?
No. See, IVF is truly a blessing, but it is not the first helpline number we seek for. Yeah. The first, we teach the patient, we guide the patient about the fertile period. What is the most fertile period in her menstrual cycle? We guide them to have intercourse during those days. If that doesn't help, the second is we give the basic ovulation induction drugs, that is जो egg बनाने की basic medication होती है वो देते हैं. Last day हम एक injection देते हैं जिससे egg release होने में help करता है into the fallopian tubes, and we again guide for them timed intercourse. In the third option, it comes IUI. IUI is also the same. We give the basic ovulation induction drugs, injection for the release of egg, and then we wash the semen sample in laboratory and we inject it inside the uterus at the time of approximate ovulation time. 36 hours after the last injection.
Okay. So now next question is, who might need it? This IVF.
See, there are many indications. In some cases, we go for IVF directly without trying this all basic treatment, because in such cases, the other treatment won't help you. Like first, blocked fallopian tubes. In such cases, there is no point of giving the drugs or giving the IUI. Second, like if the husband semen count is very poor, that is a less than 5 million count, motility is very poor, morphology is very poor, that is a very bad semen report, or the semen count is zero. So in those cases, we have to retrieve the sperms from testes directly under anesthesia. Similarly, we retrieve the eggs from the female patient. Both the procedures are done under anesthesia, so there is mild discomfort but no pain at all. Third indication, you can say, that is the endometriosis. Other medical indications like endometriosis or fibroid, the uterus is not healthy. So we prepare the uterus medically or with hormonal medicines before we put the final embryos. And in some families, there are history of genetic problems like thalassemia is running in the family, or particular disease from which we have to test the embryos before placing into the uterus, whether this embryo is genetically normal or not. Then in those cases, we go for IVF. And at last, like some occupations which demand the long distance relationship, like in army or in the navy, in those cases, some couple might need IVF.
Okay. Now it is interesting. Okay, so next question is, what are some concerns people have about IVF?
सबसे the biggest concern or myth I should say कि हमारा बच्चा नहीं होता, which is absolutely wrong.
Okay.
It is, the baby is formed only from the mother's egg and the husband's sperm. In cases where we find कि we need donor egg or we need donor sperm, we advise them, we take their legal consent, and then only we go for donor egg pregnancy or the donor sperm pregnancy.
Okay.
So first, it's absolutely their baby only, the patient and his husband. Second concern, it is painful. No, it is not painful. The little discomfort could be there because of the ovulation injections. Ovulation जो हम medicines देते हैं या उनको injections देते हैं egg बनने के लिए, उससे mild discomfort हो सकता है. But the main जो painful थोड़ा procedure बोल सकते हैं, that is the egg retrieval procedure. We do it under anesthesia. So there is no pain, just mild discomfort, and that is okay if you want. That is like an investment you are paying for the parenthood. Yeah.
Okay,
so,
now this is beautiful. Now whole podcast is gonna be beautiful, and this is the end of a first episode about basics of IVF. So in the next episode, we'll talk about something interesting.
thank you.
Okay.